Well, inmates can be in jail for a long time, and at some point they're likely to need medical care. That medical care often falls to infirmary nurses. Our Keely Shields went to the Lowndes County Jail to find out what nurses see in a day and why they choose to give care to people who are behind bars.
For Sarah Rickert, working at the detention center was her first job out of the Army, and she figured she would only be there for a few months. 26 years later, she'll now tell you that's her calling. Infirmary nurses like Brandy Reynolds and Sarah Rickert can sometimes have a heavy caseload. They are responsible for providing health care to the inmates at the Lowndes County Jail. That can mean they can deal with as many as 288 patients.
On a daily basis, we do blood pressures, we do blood sugars, we keep up with all their medications. We make sure that just like they were at their house, we take care of them here. We also go a step further to if there's emergencies or anything like that, we assess them as their nurses, and we'll call the doctor or we can send them to a hospital.
Rickert says it was after a mission trip that she decided it was her calling to give care to those in jail. She says one of the most important things is seeing them for who they are.
Every single person that is here is a person, and it doesn't matter what they've done, we still are going to take care of them to the best of our ability. And we're going to treat them like human beings because they are.
Over at the Clay County Jail, Sheriff Eddie Scott says his team is fortunate to have a doctor, nurse, and community counseling on staff. Infirmary nurses have to be knowledgeable and flexible.
We have some inmates that has extreme medical issues. We work very closely with our jail doctor. If they need to see a specialist, all that is organized and taken to them.
While they may be behind bars, inmates get the same medication they would on the outside.
Medicines are just like the general public. We have to pay the same thing at the drugstores. And with me on an average of 90 inmates, you can about see what our pharmacy bill runs a month.
And while the medical staff is there to assist needs, Rickert says it's important to her to give care beyond the infirmary.
They need help with staying clean and sober. And so me and my husband actually have a group that we meet on every Sunday night called the Recovery Room, the Assembly Recovery Room. And we meet and we just love on them and just help them the best that we know how.
Nurses are on call 24/7 even after the regular shift ends.